Right, last one, Mind and Body, part 3. All to do with the drugs. Now the drugs don't work. They just make you worse, but I know I'll see your face again. Extra point if you can guess who that was. And don't say me. Right, first drug we're going to look at is anabolic steroids. Quite a common one. Reasons athletes take anabolic steroids: speed up recovery time. They do it because of the pressures of others, a bit of peer pressure. Increase their chance of winning. It also gives them an opportunity to train for longer and harder, so then therefore they can increase their power and strength. And last one is it helps to develop lean muscle mass. So basically, why do they do it? They're your reasons for it. This is classed as cheating. Types of people that may use this tend to be athletes, just sprinters, any type of event that needs power and speed. And you also may find that it's quite a common occurrence in weightlifters. So what are the significant side effects for taking anabolic steroids? Liver damage, testicular atrophy. So we know that atrophy means decrease. So around the area, it actually decreases your sperm count, which obviously can lead to the fact that you'll never have children. Skin problems, acne is quite a common side effect. Big one is mood swings. People that take anabolic steroids quite moody, quite stroppy, fly off the handle for next to no reason. And in gentlemen, it can also cause premature baldness. So that is anabolic steroids. That is drug number 1. Anabolic steroids, the reasons they take it, the side effects, and that's what you really need to know, and what sports that they may use it in. The next one we're going to talk about is beta blockers. Beta blockers have a calming effect on people, so they reduce the chance of people being nervous and shaky. Again, because they take this, if it is a particular sport, let's take snooker for instance, it obviously increases the chances of winning because it allows the performer to keep calm and control, and also helps reduce the chance of anxiety, so nervousness. Health risks for taking beta blockers: it slows your heart rate, therefore obviously slows down your oxygen delivery, which could lead to the point where you may actually pass out, or you've not got enough oxygen going around your system. So in an endurance performance, you would expect your performance to drop, especially if this is going over a long time. It lowers your blood pressure, and it can also disturb your sleep, leading to tiredness, so therefore having an impact on your tiredness and your concentration levels. People that tend to use this, I mentioned snooker people. It tends to be the people that do precision sports like snooker, maybe archery, any type of target shooting, gymnastics, or even diving. I'll move slightly on to our next one, diuretics. I probably pronounced that wrong, Joe, and you'll probably tell me the correct way when I see you next. So you diuretics. My word, I'm getting it. Joe's got it in my head and he's not even here. People that take this to achieve quick weight loss, and also to hide or mask the fact that they've taken other things or substances. So if somebody's taking something legal, they may take this because what it does is just flushes out the system. Health risks according that come with this are dehydration, nausea, headaches, heart and kidney failure. So it's quite an extreme one, this one. People that may take this, people that let's take some weight-based sport. So boxing, if someone needs to make the weight, they may take this drug to flush the system, help reduce the weight so they can make it. And also horse racing, jockeys, they need to be a certain weight before they do an event, they may also take this. And anybody that may be trying to mask the fact that they may be taking some type of drugs, and they want to hide that fact. Right, you've only got, I think there's 2 more. Narcotic analgesics is your next one. This helps, the narcotic helps to increase the performer's pain threshold. It also helps to, let's just say, mask injuries. So say, let's use Bobby, who's had a bad knee. You may take this type and maybe get an injection from this. to maybe playing his sore knee just helps him get through the next game, which may be an important game. People that take this obviously have a sense of him being invincible because they feel like they're a brick wall and nothing can hurt them, and also gives them that sense of euphoria that, wow, nobody can touch me, I'm untouchable, I'm unplayable type of thing. Health risks associated with this: obviously when you're taking this type of drug, it can cause nausea and sickness, it can cause anxiety and depression, kidney and liver damage, that's like another one, addiction to it, the feeling that you need to have this in order to get through every type of game. It has an effect on your concentration loss. But also, let's say that Bobby takes this to mask his knee so he can get through the next game. It can cause him further damage in his knee by the fact that he does this. Any type of performer that's got an injury could use this. So let's use footballers, swimmers, boxers, anything like that, rugby people, anybody that may be carrying some type of injury. And it used to be quite common in American football. They'd had a knock on a certain area, if they had a bad knee, they would get an injection which would help them get through that next game, especially when they're going through towards playoffs. So there's your narcotic analgesics. Next one are your stimulants. Stimulants taken to increase levels of aggression, increases alertness of the person, reduce tiredness, increases heart rate, therefore oxygen delivery gets around your body a little bit quicker, and increases competitiveness. So it gives you that real, right, let's get on with this. You know, like some of you will have before you play Blessed Trinity, right, let's take it to them. You get yourself psyched up. Stimulants obviously can do this. Health risks associated with it: it stops you with your sleep, so it can cause insomnia. Obviously it can cause anxiety. Aggression comes hand in hand with this one. So you get yourself all pumped up, worked up, ready to play. Aggression comes in with it. But it also can create problems with your heart rate beat. So you can have an irregular heart rate. People that take this, it can range from any type of hard impact sports. Let's use boxing, rugby and ice hockey. You may also need somebody that needs to stay alert with regards to performing. So let's just maybe say some type of person that's doing an endurance event, maybe even like a racing car driver that's doing like a Le Mans 24-hour race, needs to stay alert and awake, he could take that. Actually, I lied. There's one more drug that you need to know about. It's called your peptide hormones. Peptide hormones are helping with human growth. People take this to increase muscle mass and therefore increase strength. It can also help increase red blood cell production. So we know red blood cell carries our oxygen around our body. If we have more red blood cells in our body, that means we'll have more oxygen going to our muscles, energy is being transported along. So any type of peptide hormones can help with muscle growth and also delivery of oxygen, increase of red blood cells. Side effects for your human growth hormone, which is your HGH, which is your muscle mass one. You get arthritis, heart failure, abnormal growth in hands and feet. But with you guys being from Burnley, you know all about that. It can also lead to diabetes. Your EPO, which is for your red blood cells, increases your thickness of your red blood. It can cause blood clots, and if you get blood clots, it can lead to strokes, also deep vein thrombosis, and also increases your risk of heart attack. Why would people use it? Your HGV, your human growth hormone, which is your muscle mass one, it's basically for strength. And your EPO, your erythropoietin, which is your red blood cells, is an activity where oxygen is delivered, so long distance running, long distance cycling. I know this is a long video and this is going to be a last one. The negative effects of recreational drugs, and your two that you're going to be looking at and focusing on are going to be your alcohol and your cigarettes. Hopefully none of you do either, but alcohol can lead to heart failure, increased blood pressure, increased weight, liver disease, liver cancer. And your cigarettes, obviously with your nicotine, lead to stroke, bronchitis, heart disease, blood clots, lung cancer. So we all know why we shouldn't do that. We all should know about the negative impacts it would have on it. Alcohol leads to slow reaction times, makes the drinker less mobile due to excessive weight, loss of concentration, loss of coordination, and smoking obviously has an impact on the amount of oxygen we can carry around our body and causes breathlessness. And all drugs are done. You just need to know about reducing risks within sport. You should all remember this. This is our wearing helmets on a yacht, not seat belts. So remember, we need to reduce risks in sport. So in boxing, we wear gum shields, we wear padded gloves, we wear wrist wraps, we wear head guards for amateurs, things along those lines. And then also within a sporting context, not just the equipment that we may wear, but the things that we help. So in rugby, they have the posts, that padding around the posts that help prevent things. But you also need to be aware of things that are on the pitch. So there's a glass, is the pitch a mess? Are you playing on an unplayable pitch? And you also need to take into account the age difference of the people that are playing. You wouldn't have a year 7 playing with a year 11 in a football match. Obviously it poses its own risks. So think about all them things. I know there's a lot, and this is a long video, but when you're thinking about your drugs, recap them all. At the end of it, you also need to think about personal health and reducing risks. So what do you wear in matches to help prevent injury? What do you do before matches to help prevent injury? What do you do after matches to prevent injury? And also think about the other things that we take into consideration: the people that play in, the age of the players, the condition of the pitch, condition of the equipment, and also removing objects that may be deemed unsafe that could cause an injury. I know this is a big one, maybe worth watching this a few times. Good luck on your exam on Friday.